Central Focus is great with the wide span of providers that we have here. People have their own individual specialties, whether it's certain types of neuropsychological assessment or certain approaches for therapy or medication management. So when we have a patient come in, let's say they sought out counseling, the patient will come in, they meet with their counselor, and the counselor talks with them and they're like, I really am not quite sure what's going on with you. I think we need more information. The counselor can easily refer them to the psychological assessment department of Central Focus, and we can do a diagnostic evaluation, which will help streamline the therapeutic process. If you know exactly what's going on, it makes it easier to treat and to teach you how to manage what's happening versus guessing and kind of, throwing darts at the wall. And then the same thing happens if we diagnose something that could really benefit from medication options and the patient wants those, we can refer over to the medication management team, and you can come handle all of those appointments in one place. It makes it very easy and streamlined to get your care and get feeling better faster.
Successful psychiatric care for me involves having everything checked off. You can get your medications, you can get your therapy. Those are all great and really important to have, but if they're so separate from one another that they kind of just exist in these separate pillars, it's not great. I think if they could be integrated in some way, and if there's a way for us to, with our neuropsych evals, that's a very comprehensive understanding of what's going on. So you have a really academic and comprehensive understanding of what's going on, and then you take a multi-pronged approach to treating it, you can really have a fully encased treatment, approach to addressing this, and I think that can be very helpful.